So there are two clades of Mpox. Clade 1, which causes more severe illness and can lead to death. Outbreaks have killed about up to 10% of people, so much more severe. And the current variant is a Clade 1b variant, so it's of the more severe strain. And we also have Clade 2, where it has a much higher survival rate. It's much more mild strain. So the reason that the WHO has called for a public health emergency of international concern with Mpox is the new variant Clade 1b, but also because once again, we are seeing that it is spreading beyond its endemic areas. So not only is it spreading across the African continent, but also now cases reported in Sweden.
How is it spread and who is likely to be vulnerable to it? Children are being infected.
So children are highly vulnerable. We see that the main mode of transmission is through skin contact with the lesions that develop. So with this virus, Mpox, you have much like the lesions from smallpox. These are both from the orthopox virus family. These open wounds that can develop all over the body are the most infectious areas. So you need to have direct skin-to-skin contact. So the people who are most at risk are men who have sex with men, but really anyone who comes in contact with an infected wound can then, these ulcers that develop, catch it. There are some very complex dynamics in terms of transmission, and so much more studies and epidemiology need to be conducted to fully understand, but really that's the main form at which people are at risk to catch the disease. So quite different to what we saw with COVID in terms of very much an aerosol-driven disease.
How concerned are you at the rate of contagion so far? As you mentioned, we're seeing cases pop up in North America, Europe, and now Asia after significant outbreaks in Africa.
Certainly this is concerning because we see the mutations occurring. So that can alter how the mode of transmission can occur in future as well. And that's one thing to really be aware of and monitor. So one of the reasons that this is a public health emergency and the WHO has used this mechanism is to rally funding mechanisms to ensure that faster containment, vaccine dissemination and distribution can occur. In the pandemic potential of this is not, again, it's very different to what we saw with COVID. So I'm not concerned on that level, but again, there is really a high risk for people in these endemic regions, like particularly again, children, and it's all very preventable. So from that perspective, if we can get quick access and the resources to survey populations, then we can really keep this from spreading further. If that doesn't happen, if we don't have international solidarity support, if we repeat what happened during COVID-19 with high-income countries hoarding vaccines, then we will see, again, many more unnecessary deaths and can actually further inflame geopolitics as well.
So how should health authorities around the world be responding to limit the spread of Mpox in their country, and what advice should they be giving to their citizens and travellers?
Well, the WHO does not recommend border closure. I mean, this is devastating for trade, and it's really harmful for economies, and it's, again, those in the more low-income bracket that will be affected. What countries should be doing is ensuring that public awareness is high, particularly that their healthcare workers are trained to be able to detect this at the community level, that groups that are at most risk are also targeted specifically, and that we're doing more intensive monitoring to better understand how this disease is changing. Because again, there is now a new variant, Clade 1b.
If Congo, where it seems the main outbreak is taking place, can get access to enough vaccines and education and awareness, do you think the outbreak can be contained there? Are you hopeful this can happen?
I certainly think so. With the correct resources, there will be challenges. It's not just also having vaccine access, although that is one of the barriers. It's also then ensuring that we have trust with communities, that that vaccine then gets used, that the anti-vaxxer and misinformation isn't overtaking the public health efforts. And we have, again, learned some lessons from that during COVID as well as to how to best engage with communities to maximize that uptake. So it's really a twofold strategy, ensuring that A, the resources are there, but B, that that uptake is occurring.
So overall, what would your assessment be? How concerned should we be about Mpox at this current point in time?
Again, I don't think that this is going to be a pandemic level threat, but it is a public health emergency of international concern because of the unusual spread, how we're seeing it, again, not being contained by the routine measures. We shouldn't panic people. Most of us who are aware, who are looking at safe sex practices, et cetera. There's many ways to protect yourself because as this is a skin-to-skin contact way of the disease transmitting, there are many ways to prevent that. And I think that, again, it's a serious issue, but not one that should cause international alarm and panic.
Professor Oksana Pyzik, great to talk and get your views. Thanks so much.
Thank you.